Merry Friday Eve, Ability fam. Today we're going to dig in deeper, and actually we're not even going to focus on one component. We're going to focus on a couple because, again, they're so interrelated it's hard to separate those. So joint immobilization, the definition of joint contracture, the limitation in the passive range of motion of a mobile joint. So extended immobility has been identified as a causal factor. Like this guy on the right here, a lot of our patients aren't moving a bit, and neither are their joints. When prolonged immobility is the initiating factor, the mechanical properties of the healthy connective tissue of the joint will be altered negatively. So joint contracture affects the essential function of movable joints by limiting movement and mobility, resulting in a negative impact on essential daily activity and healthy lifestyle. Now, an object at rest stays at rest, so we need mechanical stimulation, which is why they've got us. So lack of mechanical stimulation is a common thread in the etiologies of joint contractures. So mechanical stimulation of joints is clearly necessary to maintain joint function and homeostasis of the connective tissue. This is why we don't want people to self-adjust. They are not getting the correct mechanical stimulation in the correct spots. So we need to maintain the joint function and movement in that area throughout the healing process. Loss of range of motion. The tissues that can be involved in this include muscles, capsules, tendons, ligaments, cartilage, skin, and bone. So muscles can have defective motor neurons that lead to muscle spasticity. Bone, we get osteophytes and injury as well. And then the connective tissue, there becomes cartilage damage or meniscus tears as a result of this loss of range of motion within the joint. And immobility-induced contractures, the capsule surrounding the joint contributes to the limitation of range of motion via capsular shortening, capsulitis, which is just the inflammation of that, or arthrofibrosis. So that's pictured right in here. So more than one tissue, of course, can be involved, and immobility leads to both muscle atrophy, which is the decrease in muscle, and changes in the capsule. And both of those, in turn, contribute to the loss of motion. So this starts to form the vicious cycle of the vertebral subluxation complex. So causes of immobilization, the most common are macrotrauma, microtrauma, and sedentary lifestyle. So that brings us again back to that poor posture that we see in our patients all day, every day. So today, I want you to go out there, break the cycle, restore mobility, and kickstart their healing process, enhance their function, and ultimately, and most importantly, enjoy their lives. So I want you to help our patients put their pieces of their puzzle together so their picture is one of a long, happy, and healthy life. And don't forget, the only alternative to chiropractic is living a life of less than full expression.